Okay, okay.
20 minutes. Okay, let's finish it.
Okay.
Just 20 minutes.
Yes. For the cases of open fracture, our main concern is to control that bleeding, right? Yes, you control bleeding before you use bleeding. So I am going to use my carton.
But if there is no carton,
Okay, you can use a newspaper, a magazine, wood. You can use maybe a pillow.
Because this thing can be implemented inside factory also and outside factory also. So outside,
yes, of course, yeah. So you use the available. Remember, it's a first aid.
Something which is flat and hard.
Of course, yeah. Even you can use maybe a rigid spring like a timber, whereby you can, yes, you band and then you, yes, spring, yeah. So my patient has a fracture where? At this side. So the first thing I will have now to just relax. And then after I have done all that, I will have now to secure my rigid, not my rigid, but my carton. Okay, here's a fracture where at this point there. So I won't apply much of the pressure. This is where the fracture is. Okay, as I continue, how do you manage maybe a swelling at a joint? That is what we call a sprain or maybe a strain when it comes maybe to a muscle. You apply what? Just a swelling, no dislocation, but a joint reduced because of the tension. Yes.
Ice pack.
Yes, you apply ice pack. The first thing, you need to allow now the person to rest, right? After resting, application of an ice. And then remember, an ice should not come into direct contact with the skin. What will happen? It will cause a condition we call frostbite. I am multitasking. A frostbite is whereby now there is a death of the tissues because of the severe coldness. Yeah. So just take a glove, but if you have maybe a package ice pack, you can use that, right? Yes, you apply. Then after applying, you can maybe use a crepe bandage to do what? To secure in that place for like 10 to 15 minutes, and then you remove. After removing, remember we have done application of the ice. You compress. After compressing, remember you have to use the crepe bandage now to rub at the joint. Then after you have done all that, you elevate the extremity. Yeah. Now I am managing a fracture. Okay. So I have applied what? A splint. Now I have to apply what? A sling. This is what we call a sling. I hope you can see it. Just bring forward slightly. So at the patient back of the neck, you can decide either to palm, right? Yeah. Okay, management of maybe a swelling on a joint. There are some of the people, they do what? Relax. Some of the people, they do apply what? Deep.
This boy food.
Yeah.
Is water? Okay.
This is what we call as
Mugali. My
yes, you can put at the back of the head. Then from there, remember your work must be very neat. You need to tighten. I think it is your phone.
Should we pass? You want?
Yes, it is.
Did you pass?
Okay, then after you have done all that, you apply something we call a sword, whereby you need to prevent front and back movement of this. Just lean forward. And after you have done all that, this is what we call password. At least now to prevent forth and the back movement of the arm. Sasa. Then I come on other side. That is on, and I can give something. My patient now to on. Just keep on pressing. At least now to improve the circulation of that affected. And then from there, let us go to hospital.
Call ambulance.
It's very comfortable.
But it's now okay. No, it's good.
So that is how we manage a fracture at the forearm, right? Okay, at this location on the elbow, you can apply maybe a big carton or something that is very soft that it can conform.
Wood, yeah, bamboo.
Yes. Okay, if you don't have all that, you can apply maybe a rigid splint, just a rigid splint timber, maybe padded at the side, and then you secure them, and then you apply this one, and then as well.
This is the basic technique now.
Yes, this is the
actual
basic.
situation.
Okay, let us focus on the
Yeah,
cartons.
this
Yes,
is
exactly.
basic technique.
Yes.
Actual situation, whatever is available, you have to utilize
Yes,
that
yes,
as
yes.
per this.
Of course, yeah. If you have even maybe A4 book, you can make use of that. Anything that it can maybe help the patient, make the use of it. Okay. I hope. Do we have ice pack here?
Yeah, here, inside. That. You want?
It's a dry ice pack.
Okay. So, before we go to that ice pack, how do we manage burns? A chemical burn. I am
Maybe how
very
do you guys normally do it?
Yes, how do you manage a chemical burn? Remember, we have a burn and we have a scald. A burn, okay. A scald, it is whereby maybe you have been burned by a liquid chemical, right? Or maybe by a liquid kind of the thing. A burn, we have a flame like a fire, right? Okay, how do you manage maybe a scald? When to burn? Yes, the first step.
Put it under running water.
You put it under
Lydia.
water. You put inside. You have to irrigate the area, right? Okay. If it is maybe a chemical burn and it is a powder, how do you manage it? You have to remember, consider your safety. Yes, you can either use maybe an heavy duty gloves, the one you normally use, right? Just for your safety purposes, because some of the chemicals they can burn even. Yes, of course, yeah. So you have to brush away the powder just against the wind, maybe, yeah, right? You brush away. Then after you have done all that, you have to irrigate the area. How many minutes? Remember, it is a chemical burn. How many minutes?
Irrigation.
Okay, you irrigate. You water the area. You have to use a running water. A running water. It doesn't you're not supposed even to be maybe at the top in order to irrigate the area. You can use maybe a jug. Yes, there's a way of irrigating the area, right? For how many minutes between? Remember, it is a chemical 15 to 20 minutes. And then after you have done all that, you use a burn dressing. In fact, I don't know if you have a burn dressing, a paraffin. It contains something like maybe petroleum jelly or something like that.
You can't cover the cream. There is a cream, right? White color cream is there.
Yeah, it's
For
there.
burn only. But it's not there.
It is not there.
It's there, I can see. You know that white cream for
Yes, white, yes,
white color
yeah,
for
yeah.
feeling cold.
Yes, of course, yeah. If you have that cream also, you can use it. But ideally, the moment you don't have that cream, you can use any material that cannot stick onto the wood. A dry material, you try now to, yes, rub the area, and again, maybe you can, yes. A burn, maybe there is an outbreak of fire in this area, maybe self forbidden. Yes. Maybe a person has been burned by a fire. How do you manage it? Remember, you need to stop the process of burn, right? Yes. How do you manage it? Maybe I have been burned and the area is very painful. The first thing, irrigate the area between 10 to 15 minutes, right? You use a paraffin, gauze, or a burning dressing. You cover the area, and then you secure the area with a material that cannot stick onto the wood. I hope we are good after that.
So cotton we don't have to use because cotton immediately agrees.
Yes, for us, yeah. But you deal with chemicals?
Flammable, I don't think so we have.
Okay.
We have just a normal thing,
Okay.
which has
Electrical burn?
Yeah.
We don't pour water in the electrical burn,
Okay.
but maybe a burn from a gas, any solid, yes, you can. But you will find that now there is some of the chemicals that they do react to water. Will you continue getting the area? No, you stop. You cover the area using a flapping material. No, never use a cotton wool. You secure the area, and then from there, further manage. You advise later. It's not a matter that you take that person to hospital. You can continue to ask them later. Yes.
It is small one.
Yes, exactly. There
Or something very severe one.
yes,
Something very severe.
very severe. The first thing, managing pain, irrigate the area. Severe burn in which part of the body?
Somebody like get one, a body.
Fire.
Body.
Fire.
Oh, the fire.
Yeah.
Okay,
How
in
to
order to
stop
stop
that?
the burning process,
Yeah.
remember this person, the burn is still in progress. You have to just, but don't pour much of the water. Yes, just in the area that that person has been burned. Yes, just a little, yes, you irrigate, yes, to stop. Okay, now, let me emphasize on just a few things. Let's say, for example, you have been burned. You have come out of the burning building, and your cloth is still on
Sticking,
fire.
yeah.
Yes. How will you manage it?
And
Your-
A blanket or a thick
The
which
first
we
thing,
see nowadays in
remember,
movie.
you have come out of the burning. You are very conscious.
Yeah.
You are just running,
yeah.
yes, but now your cloth is already on fire. The first thing, don't panic. You stop, drop, and then you roll on the ground. Yes, that is the management. Right? But now when it comes maybe to a gas, okay, that is by martial, but no problem. A gas maybe it is about now to catch on fire. Don't panic, don't throw the gas away. So what you are supposed to do, fire blanket.
Right.
Yes. If you don't have a fire blanket, just a sheet, dip it in water, you cover the gas, and that is all. Right? But you are supposed to be having a fire blanket here in case of whatever it is, right? Yeah.
But we cannot use this on a person.
You cannot use that on a person. Maybe
Because sticking their body, this one.
in your body, don't
That powder is there.
Yeah, powder,
Inside.
many powder, this one sticking.
Inside there is a powder.
White powder.
So like
But,
if you see somebody is burning on the lower part, then you cannot use that
burning.
for fire
For the
extinguisher.
first aid, I do say maybe what is the best?
Water and fire
Yes,
blanket.
what? Yeah. We have some of the fire extinguisher, they contain what? Water, right?
Okay.
Yeah. But never use anything, a powder on someone.
Directly.
On some, never. Because the moment that person reaches to the hospital, remember that wound must be very fresh.
Yeah.
And when the doctors, they will try now to make the wound fresh, you can imagine the pain this person will be feeling.
Because it sticks there.
Of course, yeah.
The
Okay,
powder.
yeah. Is there any question?
So is there a particular fire blanket or normal blanket which we use at our house that is also can be used?
Yes,
A thick one.
yes, of course, yeah. Because most of the homes they don't have a fire blanket, but we have the
Thick
normal
blanket.
blanket, the one we normally use, deep in water.
Or first
Now,
put
yes,
deep water,
yeah,
then
for the
use.
safety purposes, right? Yeah.
And same applies to a person also. If person is also burning, you have to dip it into water or you can just wrap a dry one.
You can do that.
That's what I.
But now when the person is very conscious, advise the person how to stop, drop, and then roll. Yeah.
Okay.
Yeah.
Alright.
Yes. Oh, electrocution. How do you manage that? Never. Okay. Like for example, person is already maybe. Just okay. So you as a first aider, you proceed and touch that person. You'll also be electrocuted. If you know where the main switch is, you can go and then switch off the main switch. Or you use any material that is a bad conductor of electricity. Like for example, we have
Because these are safety shoes. Because if you are kicking
yes,
one kicking means
never do that. Just use a wood maybe try to push now the person away from there. Yes. It's okay, right? Yeah.
One main switch need to be off.
Yes, yeah. But if you are in doubt, you can use any material that one conductor, you try now to push the person away from things. Yeah. Any other questions? Seizures? Conversion? Never put anything in the mouth. Part at the back of the head. Let the person feel his or activities. Then after finishes, what is the next step? Recovery position, seizure, convulsive disorder. But now you have to remove anything that can injure the person, including the chairs, the tables, or maybe a person is about maybe to fall where? Maybe the stairs, maybe to fall from maybe a first floor to the ground floor. You can remove the person away from there. That day, some. Yes. Never put anything in the mouth. Never.
Unaambia unaongea
Never.
sijui.